Everyone, thank you for joining. I'm William, the founder at WorkoutLabs, and I'm really excited to have you join this session. With us is Audrey, also on our team, who leads outreach to clinical teams across the US, and she will be helping follow up after the session. So today we'll talk about a topic that is critical to all cardiac rehab teams. How do we improve patient adherence and, more importantly, outcomes with better exercise prescription? We at WorkoutLabs created a platform called Train, which enables clinicians like Molly and Katie here to easily create and deliver visual, engaging exercise prescriptions to patients at various stages of rehab and beyond. But this webinar is not going to be a product demo. It's about sharing actionable and insights and strategies that you guys can take home to your programs and implement right away. Let me share my screen. I have a couple of slides that I forgot to put up. So the next 45 minutes, we'll start with guest insights from our clinicians from Providence St. John's and Boston Children's. We'll have a brief Q&A session if we have questions for the guests, so you can ask them what you're curious about more. And after that, I'll share a quick walkthrough of our training platform so you can see what it looks like in action, followed by a few more minutes of any questions about the platform itself. And we'll share the recording after the session. And everyone who attends and who is registered will get an extended 1 month free access to the training platform to try with their team. So now I'm thrilled to introduce, whoops, I should be jumping to the next slide, not moving things. There we go. Introduce our guest speakers. First, we have Molly Wainstock. She's the cardiac rehab manager at Providence St. John's in Los Angeles. And joining her is Katie Cameron, senior exercise physiologist in the Pediatric CR program in Boston Children's. They've both been using Train in their programs and have generously offered their time to share their experience and lessons. If you guys have questions for them along the way, please drop them in chat and we'll circle back to them after their presentations. And with that, Molly, I'll hand it over to you to start.
Thank you so much, William. Thank you for inviting me to be part of this webinar. I know it's your first one, which is exciting. I'm excited to talk to you a little bit about the platform and how I've been using it in my program. With exercise prescription and home exercise adherence, I think it's one of the biggest sticking points, at least for me in my practice in cardiac rehab. I've been working in cardiac rehab for about 15 years. And home exercise, I think making sure that patients are doing their home exercise and motivating them to do home exercise is, first of all, really important and also really difficult to prescribe exercise at home. And I think, we tell patients you need to be walking every day, at least 30 minutes, which is pretty standard, but we want them to do more. We want them to not only walk at home, but we want them to strengthen their muscles. We want them to really, what's the word I'm looking for? We want them to supplement what they're doing in cardiac rehab with exercises that are actually helping them to improve overall. And it's going to give us better outcomes and also the patient better outcomes and better quality of life. So giving them a usable home exercise program that's more than just the generic like walk at home, I think is really important. So some challenges that we face is just time. How do we get the time as, a pretty lean staff, which I have here, but also many programs have. How do we have the time to create really engaging home exercise workouts for patients? We have been using the Train platform. I think it's been really helpful. One thing that we do is I created a whole bunch of workouts on my account, and we have them printed and we give them to each patient when they're starting and then as needed, depending on what their goals are. So we have like a core program, we have a upper body strength training program, we have a lower body strength training program, we have a balance focused program. So we give them kind of the generic home exercise ones, but then we also give them home workouts based on what their individual goals are. In cardiac rehab, we also have we have a bunch of strength training equipment. We have dumbbells, we have resistance bands, we have a big cable machine. So what I did is I created workouts targeted at a bunch of different areas for patients. So we again have a core workout, we have a dumbbell workout, we have a cable workout, and I've laminated them all and put them in various spots in the gym so patients can just pick up those workouts, and they can kind of do them at a self-paced way. And that's been really helpful for our staff because they'll show the patients the workout, they'll teach them the first maybe one or two times, but then they have the workouts already printed, so they just pick it up off the hook in the wall. And they will do it themselves. So saves us a little bit of time, helps us, again, create more engaging workouts. I've been part of some cardiac rehab programs that just have like very generic dumbbell workouts, and everybody does kind of the same 5 or 6 exercises. So having different programs that patients can use depending on what their goals are really helps individualize and tailor each person's strength training program. We have used, I know the Train platform has some pre-built cardiac rehab programs in there, which we've also used. They have been helpful, and there are some also that target like specific conditions too. So, for example, there's one that's like a post surgery workout plan that you can give to patients while they're in the hospital for discharge to help get them from discharge to cardiac rehab, and then you can also give it to them in cardiac rehab, so they know kind of what workout they should be doing after they have open heart surgery. One feature the training program also has is that you can you can like add patients to the program and create individual workouts for them. So that allows for even further personalization in the program. So you can print it out, it'll have the patient's name on it, it'll have your hospital logo on it, which I like a lot too. You can personalize how it gets printed out. And you can individualize the program for each patient, and you can adjust it as necessary. So I'll give you an example. I had a patient who has a home in New York. So he was traveling to New York from California, where I am, for a month. And he was going to pause his cardiac rehab program for a month. So what we did is we added him to the Train platform, and we created kind of a 4-week workout regimen for him so that he would be consistent with his workouts when he was away. And then also have this progressive program so he could keep up with his progress, instead of losing all the work that he had done in cardiac rehab. So that's something you could do is, depending on the patient, you can really individualize it for them. And it's just an added way to get patients to adhere to your program and also their home workouts. It increases their motivation. And increases their satisfaction with your program too, because it's the way it gets printed out is really professional. It looks great, and patients can easily follow it. I think for me, the biggest benefit of it is that you can have the option to print out instructions with each workout, and it comes out with a little picture too, and it highlights which muscle group each exercise is targeting. So for me, I think that's the biggest value in the Train platform is that it has the instructions and it shows patients exactly what muscle group they're working on. So I think that was kind of the
Awesome.
bulk of what I say about it. So thank you so much.
Thank you, Molly. It sounds like you're taking full advantage of the platform, both on site and also for patients that are away. That's awesome. Katie, over to you.
Awesome. Thank you for having me. So we here at Boston Children's use the train platform like ever so slightly differently, I guess. We actually, I was speaking with one of the other exercise physiologists earlier and to see what life was like before WorkoutLabs. And she was telling me that they actually used to search, like Google search images of workouts and then would copy them into a Word document. And it was always really bulky, really complex, and ended up finding more and more images and then realized, oh, this is a great picture. Where is this from? And that's actually how we came across the platform. And so I've been using it ever since. So at this point, we typically, like whenever a patient joins our cardiac fitness program, we automatically make them an account on WorkoutLabs. We haven't utilized the part where they have access to it, just with the variety of ages. Sometimes it gets to be a little bit difficult for our patient population, but it just gives us the opportunity to, every single patient has a profile, and so we can work from that. We've had people come through the program a couple of times, and so we can always refer back to the circuits that we had introduced to them previously. So at this point, we currently have we've had over 200 patients that have come through the program and have received workout lab circuits. So we all kind of have fun making them. We have a little bit of a larger staff, so luckily we have the ability to do this. And so we use not only our personal experience, but also experience from other patients that have gone through the program to create all of these different workouts and things. And so each patient ends up, I was thinking like on average, ends up getting about 3 different circuits, not including a flexibility circuit that we then make for everyone. And so I think one of the major features and like the key features that we utilize is just filtering it and individualizing it to each patient's need. Like I said, because we see a variety of ages, and abilities, people are going to be able to do so many different things, and have an interest in so many different things. And so utilizing not only the like filtering by exercise type, like equipment, muscle group, really helps us generate all of those different circuits. I know I usually find myself, I will filter through, I'll just drag a bunch over, copy them all, and then kind of see where my brain's at and look through it that way. And so I'm sure we've all created, we have a team of about 10 exercise physiologists here. And so we've all probably created very similar circuits over the years, but each one has those little differences, just to help individualize to that specific patient. And I'd say one of the things along with that is just because when we then also go and ask these patients to exercise outside of the program, outside of their time with us, and even beyond their graduation from the cardiac fitness program, is the equipment and what they have access to outside and at home, at a gym, whatever it may be. And so being able to provide them with circuits and the printouts of the workouts, to then take, and they can actually use them outside of here. And so we give everyone all of the copies of their circuits. And like Molly was saying, it is great to have like the muscle groups and everything. We're a lot of times referring back to those. And then we also, for our cardiac fitness program, it's a 3-month long program. And then we follow up with them over the course of the next 9 months to create a full year. And when we check in with them, we ask, do you need copies of your circuits? Do you want anything different? Anything like that? And a lot of the time, they are always still having them and still following them and referring them back to those printouts, which I think is great. Sometimes we'll make them a new one just based off of what they've done in the past. but it's a really, really awesome platform. And one of the other things I would say we do is towards the end of the program for some of our patients, we'll give them, which we have kind of saved in one of the like the training plans, some like a whole group, I think it's like 20 something exercises, all upper body, all lower body, all core, to be able to give to them. And then they have basically like a booklet of exercises. And so we're just like, okay, here you go. You can now create your own circuit to be able to do everything with the understanding of what muscle groups you're working, how this is going to benefit them, and can go from there. We have also utilized the WorkoutLabs cards, like the deck of cards a lot. And so we have a few copies of them at all of our various locations, as well as we've actually pulled up the train platform with the patient in the room, and before they start warming up, they can click through the exercises and choose it themselves. And so having them having that interactive feature, I would say we probably tend to use the cards a bit more. But then a lot of times, if as they're searching through the deck of cards, we'll then go onto the train platform and then be able to give them a printout of those exercises. And so I just feel like it gives the patients a little bit of independence and makes it a little bit more fun and enjoyable for them, and for them to realize like just a different side of things, that we're not like necessarily like forcing them to do anything like this. And they're choosing these exercises and it's what they want to do. And they know how it's going to help them improve their lives overall.
Great. Yeah, it's interesting
That's
how
kind of
you're. Thank you, Katie. Yeah, that's new for me to hear someone actually involve the patient in creating the routines. That's a good idea. It makes them more.
Yeah. I just had a patient just before this and was using the cards, and he was looking through them all, trying to decide which ones he wanted to do. And even in the deck of cards, I know there's some cards with circuits already made on them too.
Yeah.
And so just, utilizing all of the different features and everything is amazing.
Thank you. Yeah, that's two very different use cases, and together they really, I think, give some actionable tips and strategies to everyone who's attending. Let's see, we have a few more people joined us since you guys started. Any questions? If not, I have a couple that I wanted to ask Katie and Molly. There's nothing in the chat, but feel free to just join the call with audio and video and ask your question. Going once, going twice. One question I have, and everyone else feel free to jump in. Well, actually, two questions. One is, I'm curious, what's the patient's experience? How do they respond to those handouts, like the visual workouts with illustrations? Is it immediately clear what to do the exercise after you've done the orientation, or what questions do you have, if any? And tied to that is, do you know if your patients like scanning the QR code and opening the interactive workout, or do they always just follow the printouts?
Yeah, that's a good question. They like the illustrations a lot. They're easy to follow. I have seen a few. So one thing I do also is I created a like a cool down stretching template, and I printed it out on like this huge poster, and so people can follow along with those kind of cool down workouts. And I have seen some people scanning the QR code, which is great to see. And also for some of our like strength training workouts, I've seen them scan the QR code. I guess the question I hear most often is, how do I know that I'm doing it right? And that's when I show them like the instructions that are printed out with it. So I make sure if somebody I know would have trouble following the exercises, I definitely print it out with the instructions that have the picture of the muscle group on it. And that is a pretty like foolproof way to make sure that they're doing the exercises And then when I'm giving them a home workout, I usually will do it with them too, and kind of give them a few cues on how to make sure they're doing it correctly. And then I have them go home and try it and then come back and I ask if they have any questions and if they need me to help them with a couple exercises again, I'm more than happy to do that. But I think printing out the instructions is really helpful.
Yeah, I would say we're pretty fairly similar answers, especially with we'll have um some kids just in regards to the pictures. I think they're amazing. Hence why we have stuck with WorkoutLabs for so long too. And so I think it's good. We've had a good number of kids come through the program and they may not remember the name of the exercise, but if we were to show them the picture, then they recall doing it and they can kind of jump right back into it. And so even when we're having them, a lot of times too, we'll have multiple print. I'll put out all three of their circuits. We'll like put them up on the wall, and they can choose until so they are looking, I think, more at the pictures than anything.
Yeah.
And so I think it's very, very simple and like easy to recognize. And I know on the platform itself, a lot of them, when you hover over them, they kind of move and like will go to the next positioning, which is very helpful too. And then in regards to the QR code, I've definitely had a few patients that have scanned them, especially when I know they're going to be going and doing the workouts at the gym or just more out in public somewhere. Where our downfall with that is that not every patient that we have has phone, just with the children aspect. But we've definitely had, once it gets into like the teenagers and like low 20s, I've had a good number scan the QR code, and again just almost like leave it up on their in their web browser, to be able to refer back to it outside of here and not always necessarily having to carry around that piece of paper.
Yeah, I bet they think like doing workouts from a piece of paper is not cool, so it has to be on the phone.
Right. Exactly.
And for adult rehab, I think that printable format works much more than the tech way, I guess, of pulling it up on your phone. So it really serves both demographics very well. Well, last question, kind of tying back to the same information you just kind of shared, is are you able to ensure that they perform the exercises safely by using the workouts? Like, I guess you ensure it by first demonstrating them the right form in the orientation, or just going through it before they're on their own with the workout?
That's what we tend to do. Most of the time we won't introduce, because we do virtual training as well. And so typically like everyone that comes through the program and or most people end up doing like a hybrid option. And so when they're in person with us is typically when we'll introduce new exercises to them. That way we can just not only demonstrate, but then have them perform it in front of us, and to correct any form, which just is a little bit easier. Form is still tends to be corrected in the virtual setting, but it's nice to demonstrate and then have them perform it as well.
Yeah, that makes sense. Thank you. We have one question in the chat from Alicia, UTH Children's Heart Institute, and she's asking, I guess this is for Katie, if you upload the PDF to patients' EMRs. I'll say up front, we don't have integration with EMRs within Train right now, so it's not a direct way to upload it, but let us know.
Yeah, we don't, but I don't hate that idea, because I would question whether or not that they would, and I'm not sure what we use Epic, and so I don't know how much of that that they would be able to see on their portal if there's a way that to connect them. So I may have to look into that a little bit. That's a great question.
No, I'll follow up with you on that, Katie, as well. Thank you, Alicia.
Can y'all hear me? Sorry, I was messing around with my microphone. It wasn't working earlier.
Yep.
Hi, Katie. It's Alicia here.
Hello.
From UT Health. Okay, so I have a question about like uploading the PDFs, not really related to the portal for the patients to access, but more about tracking. So how do we track progress in our patient EMR if we are to involve them in like an exercise program?
So what we do, the train platform has every patient that comes through our program, we make them a profile. And then when I then open it, it comes up with the list of, I think right now we have like 208 people. And so then once the patients graduate from the cardiac fitness program, we're able to put them on pause. And just to almost like lessen the list of when we're scrolling through, so that way we're not scrolling down 200 people. And so, but we don't end up ever deleting anyone from the platform. So everyone gets saved in there, and then that way we can always refer back to see what sorts of exercises they were doing. And then our workflow when patients come in for their fitness sessions, we record in the note in their medical record what circuit was followed. And if it was a circuit that we made, we tend to just type in there the exercises that we did do that day.
Gotcha. Thank you. And then a follow-up question to that. If you are putting a documentation into their EMR about what circuits are being used, if they are done, if they've made progress, do you all query that data and export that into like a trackable chart where you see like, oh, exercise heart rate for this circuit has started from here and it ended up here by like week 5?
Yeah, we don't keep track of it as we're like everything ends up in there, but we're not necessarily tracking specifically like that.
Okay, gotcha. Thank you.
I think we don't have any more questions, so I will, thank you, Katie and Molly. I will jump into and do a quick walkthrough of the platform, and maybe some of the other questions will be answered by actually seeing the product. And Katie and Molly, if it's up to you if you want to hang around, or feel free to jump off. I know you're busy. So I will share my screen to go through the platform very quick. So this is the main screen of the platform, and this is what Katie was talking about, having a list of patients. And there's 2 ways to use the platform. Really, one is to add your patients to your account, to either then invite them from online access, or to just organize things like Boston Children's does, just to keep their workout routines created and assigned to a specific patient in their profile, even though they're not invited. So I will just jump straight to our library, and I'll come back to this screen later on. Our library contains a growing selection of cardiac rehab and other exercise programs that have built by clinicians in line with AACVPR and ACSM guidelines. And for now, we have 10 cardiac rehab programs. And each program, for example, this one is a post-surgery program to basically get patient back to full body strength after this procedure. And each program obviously has the description, why is my screen so laggy? I apologize. Has the details of the program, kind of recommendations for intensity, frequency, duration of the workouts, and then each one is composed of roughly 12 to 16 actual workouts. And you can preview each of the workouts before adding it to your account, and all of them are included, basically including with the train account. So I'll just, as an example, add this one and open the actual workouts. So I will show first the core of the program, which is the actual exercise plans that patients then hold in their hands, either on printouts or in their device. This workout screen is where you just organize the programs you create or pull from our library to then customize or assign as is. So this is the one that I just pulled from our library. These are the workouts. And as you probably gathered from our conversation so far, is that each workout can be viewed and delivered to the patient in 2 different ways. One is an interactive online workout that they can open on any device, whether it's a smartphone, computer, tablet, or even project it onto a large screen at home. This is what that format looks like. It basically starts with a preview of exercises. It has all the prescribed sets, repetitions, duration, some clinician notes for each exercise. Then one thing I'll mention is we have male and female illustrations and animations for each exercise, just so it feels more personalized to our patients, and they can tap or click begin workout to actually start the interactive workout. And if the exercises are time-based, then the whole workout will be really hands-free. So kind of you can cycle through exercises this way. When you're ready, you hit start. It'll count down. It has built-in timers, so it'll guide you through the exercise that you're doing with built-in timers or reps if it's a rep-based exercise. Then you can advance. It'll show you the rest time with, again, built-in timer in second set, next exercise. Now this is the rest between the next exercise. The next exercise starts. And what Katie and Molly both mentioned is the information on how to perform exercise step by step, and that's accessible. As I click this button, which is, oh, there we go. So yeah, this comes out on PDFs and also available in this interactive format. So it shows the primary, secondary muscles targeted and the step-by-step written instructions how to perform this exercise properly from start to finish. And there's nuances. There's the ability to swap exercises for different alternatives that target the same muscle groups. If, for example, this bench or dumbbells is not available, you can switch it to something else. So it goes through the workout the same way. You can jump off at any time. And let's say I'll stop here. It'll say workout done. We have a bunch of funny animations that show at the end. And the second format is the PDF, which I will show here. So the PDFs, you can download them just straight from the workouts screen in your account, or you can open the preview first and then generate the PDF here. Let's say I will enable those exercise instructions again. Click download, and this will take a second to generate that PDF. And you'll also see that QR code that we've been talking about to go back to the online format. So you open the PDF right in the browser. This is what it looks like. It's laid out very clearly with the sequence of exercises that are in the workout. All the same sets, reps, notes are in the PDF. And then the QR code or link to open this version is available in the handout as well. So if you print this off and give it to a patient, they prefer to follow the workout on their device, they can always do that. And then these are the additional pages that are optionally included that contain written instructions and details for each exercise in this particular workout. And as Molly mentioned, the workouts are branded, so we have our own demo account branding from The Simpsons, but basically it'll show your hospital's logo, hospital's name, the brand color. So that's what the workouts look like. And then I will share the actual interface to build or customize these workouts. So I think this is the one I was opening. I'll click Edit to load our workout builder. And this is the interface you would use to create or customize the programs. So everything is interactive. Each exercise in the workout is just a little tile that you can drag and drop to change the order of the exercises in the workout. You can click on this to set all those parameters, sets, durations, reps, rest, the notes. You can easily change the rest between exercises. You can superset or circuit them. You can kind of preview that information of each exercise right in the builder as well. And then our library of exercises is here on the right, and you can easily either search or filter it. So for example, if I'm looking for exercises that require only maybe a set of dumbbells and body weight, and let's say resistance bands, I can enable those. It will filter down the exercise list in real time, and you can also filter, for example, something for hamstrings and calves to really target legs and let's say glutes as well. So this will show you those lower body exercises that use the equipment you've chosen. And to add something to the workout, you can either, again, pick it up and drag it to the workout area, or just tap plus and it'll be added at the end. Then you can decide where it's going to go in the workout. And you can add your own exercises if you're not finding something in the library. And again, male and female images are available for each workout. So once you've created a workout with your title, description, you can either share it right away from this builder or just click save and close. It will save that to your account and it's available to share from here. Then I will go back to the client's screen. So as I mentioned, you can add patients just to keep things organized, or you can invite them as well. For example, Catherine, let's say, is a patient that we've invited for online access. I will just click on her profile to show a peek of what it looks like inside. And I'm not going to go into too much detail of what's available, but this is a dashboard that shows what workouts are assigned to her today and tomorrow. And there's a full calendar that I'll jump to in a second. There is a very flexible progress screen that allows you to track different body measurements, different things like steps walked during the day, exercise performance, anything really. It's very flexible. And this can be tracked by you or the patient. I'll just jump through the tabs really quick to give a quick overview of what's inside. If you're assigning workouts for a patient to perform on specific days of the week, then this is the calendar that you would use. Everything is interactive, so you can easily move these workouts around. You can duplicate them. They're marked done or skipped if they're today or in the past. You can kind of track the adherence to these workouts in the dashboard. You can also just assign folders of workouts or individual workouts to a patient to access, not on their calendar, but just at their own time, and they can choose what they want to do at any given moment. They can see what you've made available to them and download the PDF or open the online format to follow it on their device. And quickly jump into the dedicated progress screen. So all those things that I mentioned can be tracked in the account. They are tracked visually with a graph inside the screen. And you can set goals, and all those things are available. And then finally, if you're using the platform to stay in touch with the patient through their profile, there's built-in chat that you can really offer support, follow up. You can see what workouts they've been completing, what entries they have logged in their progress screen, and so on. Very quickly, plans is similar to workouts, but this is where you would store actual training plans that have workouts assigned to specific days of the week. So in workouts, it was just a collection of basically a folder of workouts. Here we have workout on Monday, Tuesday, Wednesday, and so on. And you can manage it the same way and then assign to patients with a couple of clicks. Messages is just your inbox for everyone that you're in touch with. And the library is, I've already visited that at the beginning of the call for the demo. So that's the gist of the platform. I'm not going to go too deep into other things that are available, but it's really designed to be simple for clinicians as well as patients. And hopefully you will find it useful. So I will stop sharing the screen. If anyone has any questions about the platform itself, let me know in the chat or just take the mic. If not, then follow up after the webinar. We will send you an email with the webinar recording, and also everyone who attended and registered will get an account set up by our team for their rehab team with their hospital's branding and logo, and we'll send you the logins by Friday, so you can start using and just testing the platform. And of course, Audrey and I will be available to answer any questions about actually onboarding you and having you guys use the platform in your program. Unless anyone has any questions, we'll wrap it up here. I think we're right on time, about 45 minutes. Thank you again to Molly and Katie for sharing their experience in their programs and using our platform, and everyone else who joined. Look for that email in your inbox today or tomorrow with all details. and have a good rest of your day. Thank you. Alicia, I see your message. Thank you. Bye, everyone. Bye, Audrey, Katie.
Thank you.
Bye. Thank you.